Okay, so our next topic is about anti-infectives. Okay, so anti-infectives are medicines that work to prevent or treat infections. So we are to discuss about antibacterials, antivirals, antifungals, and antiparasitic medications. Okay, so let's talk about the history. Okay, so Joseph Lister during 19th century discovered the phenol or other term, the carbolic acid. So it is the phenol or carbolic acid is used as antiseptic. So Joseph Lister introduced antiseptic principles for use in surgery and post-traumatic surgery. So he used phenol as a wash for the hands, so bagayan alcohol, as a spray on an incision site and bandages for wounds. So during 1881 up to 1900s, so a microbiologist, Paul Ehrlich, he discovered the antibacterial dyes and antiparasitic organic arsenicals. So at the time that Ehrlich began his experiments, there were only a few compounds that could be used in treating infectious disease, and none of them was very useful in the treatment of either gram-positive and gram-negative infection. So Ehrlich discovered that the dyes and arsenicals could stain target cells selectively, and that the antimicrobial properties of the dyes paralleled the staining activities. So in this time, Paul Ehrlich discovered the selective toxicity of other organisms. So Paul Ehrlich, kaya nakadiscoverhan magic bullets. So this is a compound that retained antimicrobial activity at the expense of toxicity to human host. So selective toxicity, so this is the property of certain chemicals to kill one type of organisms while not harming another organisms. So salvarsan, the other term of salvarsan is compound 606 or arsphenamine. So you just take note the two other term of salvarsan. We have the compound 606 and arsphenamine. So this agent is used for the treatment. So this is the first effective treatment for syphilis, relapsing fever, and African trypanosomiasis. Okay. So during 1920, most successful anti-infective agents were based on the elements. So it came from the group 2B elements, wherein mercury is found, or the member of the group 2B family, and then group 5A, wherein arsenic and antimony. So during this time, heavy metal toxicity after treatment with mercury, arsenic, and antimony severely limited the usefulness of agents containing these elements. It's because nagkakasirahin toxicity. Pero may dahil mga anti-infective properties. Although they are limited use lang kasi it will cause certain effect in our body. And then we also have atoxyl, the sodium arsenylate, and arsphenamine, which is used as a sleeping sickness. So this is the picture of the phenol, and we have the salvarsan, which is also known as the compound 606 and arsphenamine. So this chapter addresses on extremely broad base of anti-infective agents. So we will discuss today the alcohols, phenols, oxidizing agent, halogen-containing compounds, cationic surfactants, dyes, and mercurial and preservatives. Okay? So we have anti-infective agents. So they are usually locally called the germicides. So we have antiseptics. So antiseptics are compound that kill or cidal. So cidal means it can kill like bactericidal, like that. So or prevent the growth of static bacteriostatic microorganisms when applied to living tissues. So the ideal antiseptics must have low enough toxicity that it can be used directly on skin or wounds. It will exert a rapid and sustained lethal action against microorganisms. One example of antiseptics are alcohol, okay, isopropyl and ethyl alcohol. And then third, the agent should have a low surface tension so that it will spread into the wound. It should retain activity in the presence of body fluids, including pus, be non-irritating to tissues, non-allergenic, lack systemic toxicity when applied to skin or mucous membrane, and not interfere with the healing. So we already talked about antiseptics. So let's go to disinfectants. So disinfectant is an agent that prevents transmission of infection by the destruction of pathogenic microorganisms when applied to inanimate objects. So the ideal disinfectant should have first exerts a rapidly lethal action against all potentially pathogenic microorganisms and spores. Second, has good penetrating properties into organic matter. Third, shares compatibility with organic compounds, particularly soaps. Fourth, non-inactivated by living tissue. Fifth, non-corrosive. Sixth, aesthetically pleasing, non-staining, and odorless. So there are some problems with improper use of these agents. So antiseptics and disinfectants may become contaminated by resistant microorganism, which is the Pseudomonas aeruginosa or Serratia marcescens, and cause an infection. So the most common antiseptics are the skin. Kasi when we use alcohol in our hands, nagkakos talaga yayahin dryness. That's why may iba na mga alcohol like sanitizer, may danay component that can that can moisturize our skin. So yon. So simply soap and warm water remove bacteria efficiently. So regular hand washing. So skin disinfectants along with soap and water are usually used as pre-operative surgical scrubs and sterilants for surgical incisions. So most topical antiseptics interfere with wound healing to some degree, so they should be used according to the proper directions and for a limited length of time. So here are example of products that are used for disinfectants and antiseptics. So there are products also that can be used as both antiseptics and disinfectants. So we have in disinfectants, we have bleach, so Zonrox, so and then quaternary ammonium compounds, hydrogen peroxide, formaldehyde. So this hydrogen peroxide are or ethylene or and ethylene oxide. So ethylene oxide is used in sterilizing mga hospital equipments or hospital things mga gagamit. So we have formaldehyde, glutaraldehyde, and then alcohol. And then for antiseptics, chlorhexidine, betadine, chloroxylenol, and hand sanitizer. So we have here the definitions and standards for removing microorganisms. So we have antisepsis. So the definition of antisepsis, so this is an application of an agent to living tissues for the purpose of preventing infections. So we also have decontamination, destruction or marked reduction in the number or activity of microorganisms. Next is disinfection, chemical or physical treatment that destroys most vegetative microbes or viruses but not spores in or on inanimate surfaces. So we also have sanitization, reduction of microbial load on an inanimate surface to a level considered acceptable for public health purposes. For sterilization, a process intended to kill or remove all types of microorganisms including spores. Kasi 'di ba, during our microbiology, we have mga spore forming bacteria. So these spore forming bacteria, although they are not diri ra nagmamultiple or nagmi-mutate, but they are difficult to kill or to remove kasi they have these spores properties sa era characteristic ito nga bacteria. Okay, so and usually including viruses with an acceptably low probability of survival. So examples of spore-forming bacteria are Clostridium species. Okay, so we also have pasteurization, a process that kills non-sporulating microorganisms by hot water or steam at 65 degrees Celsius to 100 degrees Celsius. So we have the two of the most commonly used antiseptics. So, and disinfectants are ethyl and isopropyl alcohol. Okay, so you take note of this. These are the two of the most commonly used antiseptics and disinfectants. So we have isopropyl and ethyl alcohol. So alcohols and aldehydes. So this has been used as antiseptic and disinfectant for many years. So we have the following characteristics. So first, antibacterial activity increases with molecular weight until carbon 8 or the octanol branching decreases antibacterial potency. Okay? So as the primary alcohol chain increases, van der Waals interaction increases, which has ability to penetrate microbial membrane increases. So the weaker the van der Waals forces brought about by branching, so they do not penetrate bacterial cell membranes as efficiently. Okay? So third, as water solubility decreases, the antimicrobial potency decreases with decreased molecular weight. Okay, so we have the isomeric alcohol potencies decreases in the order. So we have primary is greater than the secondary, and then secondary is greater than tertiary. Kasi as mentioned kanina, as the branching, as may increase branching, it will decrease its antimicrobial potency of certain antiseptics. Okay, so we have isopropyl alcohol, also known as the 2-propanol. So it is used commercially instead of N-propyl alcohol because it is less expensive and it is slightly more active than ethyl alcohol against vegetative bacterial growth. So vegetative bacterial growth means how bacteria can grow and reproduce. Okay? Pero isopropyl and ethyl alcohol, these are ineffective and ineffective against spores. Okay, so if you will buy alcohol, it's better to buy the isopropyl than the ethyl alcohol kasi it is more active than ethyl alcohol against vegetative bacterial growth, which means it can slow or it can prevent the mutation of the bacteria. Okay. So the activity of the alcohol against microorganisms is due to the ability of alcohol to denature important protein and carbohydrates. So we have the alcohol. Okay, so the other term for alcohol are spiritus vini rectificatus, wine spirit, and grain alcohol. Okay, so let's talk about the different alcohols. So first is the ethanol. So the ethanol is the other term is ethyl alcohol, wine spirit, and hydrated oxide of ethyl. So it is a clear, colorless, volatile liquid with a burning taste and a characteristic pleasant odor. So it is flammable, miscible with water in all proportions, soluble in most organic solvents, and this can be prepared by the sulfuric acid catalyzed hydration of ethylene. It is most widely abused of all recreational drugs. Okay, so we have alcohol. So this has been known for fermentation, product from grain, and many other carbohydrates. So we have commercial ethanol, which is not 95% ethanols. So this forms a zeotrope in water that distills at 78.2 degrees Celsius. So what do we mean by azeotrope? Azeotrope. So azeotrope, this is the mixture of this is the mixture of two liquids that has constant boiling point and composition throughout distillation. So the term alcohol means that the substance known as ethyl alcohol, hydrated oxide of ethyl, or spirit of wine from whatever source or whatever process produced, having a proof of 160 or more and not including in the substance. So they are ethanol are commonly known also as the whiskey, the brandy, the ram, or the gin. So these are the usual nga giniinuman mga people. That's why it is the most widely abused of all recreational drugs. Okay, so we have the antidote for alcohol toxicity. So it can be fomepizole and disulfiram. So for alcohol abuse or alcohol toxicity, usually and prescribed is the disulfiram. So it blocks aldehyde dehydrogenase. So kung ikaw nagtitake ka ng disulfiram and then uminom ka ulit, you will have the effect of the alcohol to your body is you can have nausea, vomiting, and flushing. Okay? So this is the mode of action. So from ethanol, wait lang. Okay, so let's go for fomepizole. So fomepizole is the other antidote used for alcohol toxicity. So it works by inhibiting the enzyme, which is the alcohol dehydrogenase, which is responsible for the metabolism of alcohol to toxic metabolites. These toxic metabolites is called the acetaldehyde. So by blocking this enzyme, which is the alcohol dehydrogenase, fomepizole prevents the formation of toxic metabolites, providing a treatment for alcohol poisoning. So diri na iya mga ngagtuhan acetaldehyde kasi gin-inhibit na niya ang alcohol dehydrogenase from forming from ethanol to acetaldehyde. So fomepizole is fomepizole is primarily used in the treatment of acute methanol or ethylene glycol poisoning. So these are ang mga sobra-sobra na nga pagtake or kuan Yun, sobra nila pag-take ang methanol or accident nga na intake ang methanol or ethylene glycol. So for that, fomepizole is given, okay, to prevent that poisoning. So for disulfiram, okay, so for disulfiram, so this is the antidote also for alcohol toxicity, which works by inhibiting acetaldehyde dehydrogenase. Okay, so this inhibition leads to the accumulation of acetaldehyde in the body, resulting in the symptoms such as nausea and vomiting and flushing. So disulfiram is used as to prevent alcohol consumption in individuals with alcohol use disorder. So it is administered usually tablet and acts as a conditioning agent, creating an aversive reaction to alcohol consumption, which can help individual uh, para mag-abstain hira from drinking. Okay, so we have denatured alcohol. Sulfur. Okay, so for denatured alcohol, so this an ethanol that has been rendered unfit for use in intoxicating beverages by the addition of other substances. So denatured alcohol has two types. This is for correction. Disulfiram, in the slide, it is aldehyde dehydrogenase. It should be acetaldehyde dehydrogenase. Okay, disulfiram blocks the acetaldehyde dehydrogenase. Okay, so for denatured alcohol, there are two types: completely denatured alcohol and specially denatured alcohol. So denatured alcohol, they are unfit for human consumptions. Okay, so completely denatured alcohol, so this contains added wood alcohol. The other term for wood alcohol is methanol and then benzene. So combination of wood alcohol and benzenes are completely denatured alcohol. So this is unsuitable for either internal or external use. Okay. So specially denatured alcohol, so an ethanol treated with one or more substances so that its use may be permitted for a specialized purpose. So we have an examples of specially denatured alcohol here. The iodine in alcohol for tincture and methanol and other substances in mouthwashes and aftershave lotions, and methanol in alcohol for preparing plant extracts. Okay, so we have primary medicinal use or the external. So we have the antiseptics, preservative, mild counter irritant, or solvent. So alcohol also is used in the practice of pharmacy for the preparation of spirits, tinctures, and fluid extracts. So we have the spirits. So these are preparation containing ethanol as the main solvent used. While the tinctures, so they are hydroalcoholic mixtures. So fluid extracts, they contain alcohol as co-solvent. So we also have the rubbing alcohol, which is used as an astringent, rubefacient, and a mild local anesthetic. So the anesthetic effect here of the rubbing alcohol is result from the evaporative refrigerant action of alcohol when applied in the skin. Okay, so ethanol, it has been injected near nerves and ganglia to alleviate or reduce the pain. So it has low narcotic potency and has been used internally in dilute form as a mild sedative, a weak vasodilator, and a carminative. So we have here, so alcohol is metabolized in the human body by uh, oxidations. So acetaldehyde, as I've mentioned kanina, acetaldehyde causes nausea, vomiting, and flushing. So this fact has been used in therapy with the drug disulfiram, which blocks aldehyde dehydrogenase, allowing acetaldehyde to accumulate. Okay, so we have dehydrated ethanol. So dehydrated ethanol, the other term is absolute alcohol. So this contains not less than 99% of ethanol. So it is prepared commercially by azeotropic distillation of an ethanol benzene mixtures with provisions made for efficient removal of water. So it has a very high affinity on water and must be stored in tightly sealed containers. So it is used as solvent injected for the local relief of pain in carcinomas and uralgias, and they should not be ingested. It's because absolute alcohol cannot be it's because there is always some benzene remaining from the azeotropic distillation that cannot be removed. Okay, so that's why it is not safe if will be ingested. We have isopropyl alcohol. The other term is isopropanol and 2-propanol. So it is a colorless, volatile liquid with a characteristic odor and a slightly bitter taste. So it is considered as suitable for substitution for ethanol in most cases but must not be ingested. So it is prepared commercially by the sulfuric acid catalyzed hydration of propylene. So it is used primarily as a disinfectant for the skin and for surgical instruments. So it is also used in pharmaceuticals and toiletries as a solvent and preservative. Okay. So since iso isopropyl alcohol is prepared through sulfuric acid catalyzed hydration of propylene. So that's why sulfuric acid is present there. So the conversion of propylene to isopropyl alcohol involves the addition of water. So the H single bond OH is the water across the carbon to carbon double bond of propylene, followed by separation and purification steps to obtain the desired product. Okay, so that's why there's a water there because isopropyl is prepared through hydrolysis. Okay, next, take note that rapid bactericidal effect of alcohol is between 50 to 95% concentration. 40% concentration is considered equal in an antiseptic efficacy to a 60% ethanol in water solution. That's why ang mga isopropyl and ethyl alcohol that are present in the market are mostly 70%. Okay? So we have azeotropic isopropyl alcohol. So it is used on gauze pads for sterilization of the skin prior to hypodermic injections. Okay. So we have ethylene oxide. So take note of the chemical formula. So it is a colorless flammable gas that liquefies at 12 degrees Celsius. So it has been used to sterilize temperature-sensitive medical equipment and certain pharmaceuticals that cannot be sterilized in the autoclave. So mas better ini ethylene oxide sterilizer in sterilizing things that are used in the hospitals. So it forms explosive mixtures in air at concentration ranging from 3% to 80% by volume. So the explosion hazard is eliminated when the gas is mixed with sufficient concentration of carbon dioxide. So this is an example of ethylene oxide sterilizer. So this is a type of sterilization equipment that utilizes or using ethylene oxide gas to sterilize medical devices, pharmaceutical products, and other heat sensitive materials. So ethylene oxide is injected into the chamber at controlled concentrations. So exposure to skin and mucous membrane should be avoided. That's why if you are tasked to sterilize the different devices using ethylene oxide sterilizer, so bagay yan naka uh, ano ito ang ginagamit COVID. Ano tong tawag?
PPE.
Oo, yan. Tapos baka nakaputos ka, tapos nakakuan ka pa, ito goggles, like that. Okay, to prevent or exposure to skin and inhalation of the gas should be prevented also. That's why may daging gagamit na respiratory mask, PPE during handling and sterilization procedure. So dapat butos-putusan ka go dito. Okay? So ethylene oxide again. So we have the carboxide. So it is a commercial sterilant containing 10% ethylene oxide and 90% carbon dioxide by volume that can be handled and released in air without danger of explosion. So what is the mode of action of ethylene oxide? So we have germicidal action of ethylene oxide probably involves the alkylation of functional groups in nucleic acids and proteins by nucleophilic opening of the oxide ring. So ethylene oxide is a non-selective alkylating agent, and for that reason, it is extremely toxic and potentially carcinogenic. Okay, so let's move on to the aldehydes. So aldehydes are named from the dehydration of alcohols. Okay, so let's talk about first the formaldehyde. Formaldehyde solution, which is also known as the formalin. So it is a colorless aqueous solution that officially contains not less than 37% weight over volume of formaldehyde. So formaldehyde, it's HCHO. So it is miscible with water and alcohol and has a characteristic of pungent aroma. So we have 37% formaldehyde plus methanol readily undergoes oxidation and polymerization leading to formic acid and paraformaldehyde. Okay? So we have the mode of action of formaldehyde. So it is believed to involve direct non-specific alkylation of nucleophilic functional groups. So these functional groups can be amino, hydroxyl, and sulfhydryl in proteins and nucleic acids to form carbonyl derivatives. So these carbonyl derivatives, so it has a molecular targets and anti-cancer potentials. Okay, so the germicidal action of formaldehyde is slow but powerful. Okay, so if accidentally you ingest or nakakaon ka in formaldehyde, it can lead to severe gastrointestinal distress. And if nakaano ka la na butangan ka skin in formaldehyde solution, it can cause contact dermatitis. Okay, so if pure formaldehyde is ingested to your body, it can cause carcinogen or cancer in your body. Okay, so it depends on in the concentration nga na imo na ingest. Okay? So kung nabutang na imong skin, it causes contact dermatitis. Alright. Okay, so we have here the formation of formic acid and paraformaldehyde. So we have here the peratoka percent, 37% of formalin plus the methanol. It will produce formic acid and paraformaldehyde. Okay, so we have the glutaraldehyde. So the other term is Sidex and 5-carbon dialdehyde. So it is used to dilute solution for sterilization of equipment and instruments that cannot be autoclaved. So it is also used for sterilizing. Aside from the ethylene oxide sterilization. Okay, so we have the commercial glutaraldehyde. So it's stabilized in alkaline solution. So the preparation actually consists of two components, the glutaraldehyde and then the buffer, which are mixed together immediately before use. So stabilized glutaraldehyde solution retain more than 80% of their original activity 30 days after the preparation. So the stabilized glutaraldehyde solution are aqueous solutions of glutaraldehyde that have been formulated to maintain their effectiveness and stability. So glutaraldehyde, since glutaraldehyde, kung pure glutaraldehyde laia, is prone to degradation over time, which can reduce its effectiveness as a disinfectant or sterilant. That's why stabilized glutaraldehyde solution are formulated with additives and stabilizers to prevent degradation and maintain their potency over their shelf life. Okay, so that's why uncommon na glutaraldehyde they are added with stabilizer to prolong their effectiveness as disinfectant. While non-stabilized alkaline solutions, so they lose about 44% of their activity after 15 days. Whereas the stabilized glutaraldehyde solution, they can have their disinfectant effectivity for 30 days. Alright. So we have here the formation from glutaraldehyde to glutaraldehyde hemiacetals. So glutaraldehyde hemiacetal is a chemical compound formed from glutaraldehyde through a chemical reaction known as hemiacetal formation. So glutaraldehyde hemiacetal retains some of the chemical properties of glutaraldehyde, including its ability to cross-link proteins and other biological molecules. However, the presence of the hemiacetal functional group may alter its reactivity and stability compared to glutaraldehyde. Okay, so let's go to phenols and their derivatives. Okay, so phenols, so this is the standard to which the activity of most germicidal substances is compared. So yan pinaka-highest standard, the phenols. Okay, so let's talk about the phenol coefficient. So phenol coefficient, so it is defined as the ratio of dilution of a given test disinfectant to the dilution of phenol that is required to kill a strain of Salmonella typhi under carefully controlled time and temperature conditions. So, as we have our discussion, I will mention the different phenol coefficient of the different compounds. Okay, so phenol coefficient, so we have an example here. Example of phenol coefficient. So if the dilution of the test disinfectant is 10 folds greater than the dilution of phenol, the phenol coefficient is 10. So if the phenol coefficient of phenol itself is 1, it means that the chemical agent has the same level of effectiveness with the phenol. So you just take note of this. If a chemical agent or a chemical compound with a phenol coefficient of less than 1 means it is less effective than phenol. Kasi phenol itself has a phenol coefficient of 1.0. If it's less than 1.0, it means it is less effective than phenol. So we have an example here of agent that has less than 1, which is the formalin. Formalin has a phenol coefficient of 0.3. Okay, so it can kill the Salmonella typhi organism kasi it is less effective than the phenol, which is 1.0. Whereas a chemical agent with a phenol coefficient greater than 1.0, that means it is more effective than phenol. So we have an example here, the chloramine. The chloramine, which has a phenol coefficient of 133, and yon. So it means that chloramine as an agent can be used to kill Salmonella typhi organisms. Okay, so we have phenol here. So this is the standard for germicidal. So straight chain and substitution with alkyl, aryl, and halogen increases bactericidal activities. Okay, so low concentration of phenol. So the mode of action here is to denature a bactericidal proteins. Whereas, when high concentration of phenol, the mode of action is it lyses a bacterial cell membrane. So again, the phenol, the other term is carbolic acid. So it is a colorless to pale pink crystalline materials with characteristics medicinal odor. So it is soluble to the extent of 1 part to 15 parts water. So very soluble in alcohol and soluble in methanol and phenyl salicylate. So it exhibits germicidal activity, generally protoplasmic poison. So what do we mean by protoplasmic poison? So it is a substance that can damage or kill the living cells, specifically protoplasmic, that affects the organelles and process that occurs in protoplasms of the cells, such as protein synthesis, ribosomes, functions, and energy productions and cellular divisions. So it is caustic skin. It exerts local anesthetic effects and must be diluted to avoid tissue destructions and dermatitis. So Sir Joseph Lister introduced phenol as a surgical antiseptic in 1867. So phenol is still used occasionally as an antipruritic or anti-itch in phenolated calamine lotion with a concentration of 0.1% to 1%. And then 4% solution of phenol is used to cauterize small wounds. Okay, so it depends also on the concentration kung ano ang iya way nga paggamit or the medical use. So we have the liquefied phenol. So it is simply phenol containing 10% of water. So the liquid form is convenient for adding phenol to various pharmaceutical preparation because it can be measured and transferred easily. Okay, so we have the para-chlorophenol. So the para-chlorophenol, it has a phenol coefficient of 4, which means it is more effective than the phenol. Kasi phenol has only one phenol coefficient. So parachlorophenol is used in combination with camphor in liquid petrolatum as an external antiseptic and anti-irritant. Okay, so we also have parachloro-M-silinol. So we have the other term PCMX or Metacept. So it is a non-irritating antiseptic agent with broad-spectrum antibacterial and antifungal properties. So this parachloroemcylinol, the concentration present in a certain shampoo is only 2%. Okay, so the 2% concentration of parachloroemcylinol is used in shampoo. So it is also being used topically for the treatment of tinea ringworm infections such as athlete's foot and black and jock itch. Okay, hexachlorophene. The other terms are 2,2-methylene bis, 3,4,6-trichlorophenol, 2,2-dihydroxy, and 6-hexachlorodiphenyl methane. So that's the mga chemical formula. So we have gamofen, sorchicon, and hisohex. So it is a white to light tan crystalline powder that is insoluble in water, but it is soluble in alcohol and most other organic solvents. You just familiarize the structure. Okay, so the increased degree of chlorination of hexachlorophene increases its antiseptic potency. So it is used in concentration 2 to 3% in soaps, detergent, cream, lotions, and shampoos for various antiseptic uses. So it is used in general effective in gram-positive, but gram-negative bacteria are resistant. So it is banned in FDA. It's used as the over-the-counter antiseptics and cosmetic preparation since it is absorbed. It is easily absorbed into our skin and enters sebaceous glands that can cause neurotoxicities. Okay, so neurotoxicities mean it is a form of toxicity which has an effect on the structure or in our central on and peripheral nervous system. So we have the cresol. So it is actually a mixture of three isomeric methylphenols. So mixture of three isomeric methylphenols, which is in the picture, the O-cresol, the M-cresol, and then the P-cresol. Okay, metacresol, orthocresol, meta, and paracresol. Okay, so it is obtained from a coal tar or petroleum by alkaline extraction into aqueous medium, acidification, and fractional distillation. So the phenol coefficient of cresol is 2.5. So we have chlorocresol. So the other term is 4-chloro-3-methylphenol. Okay, so the compound is used as a preservative. We have thymol. So isopropyl M-cresol is extracted from oil, which is the Thymus vulgaris. So a thyme of the mint family by partitioning into alkaline aqueous medium followed by acidification. So it's used has fungicidal properties and it is used in alcohol solutions. So, and this is also used as the dusting powders for the treatment of ringworm infections. So we have also eugenol. So it is obtained from glove oil. So it is a pale yellow liquid with a strong aroma of cloves and pungent taste. So they possess both local anesthetics and antiseptics activity and can be directly applied on a piece of cotton to relieve toothaches. Okay, so ginbukutan niya ha, cotton, and then you put that on your lipon nga nagsasakit. Okay, so bagan same niya ha, lasuna. Okay, ang bubutang ha, tooth. Okay, so it is used in mouthwashes because of antiseptic property and pleasant taste. So we also have the resorcinol. So it is a weak antiseptic. It's because its phenol coefficient is 0.4. So it is less than 1. So it is weak antiseptic. So it is used in 1% to 3% solution in ointments and paste. Okay, so 1% to 3% for solution, and then 10% to 20% for ointments and paste, which is used for the treatment of skin conditions such as ringworm, eczema, psoriasis, and seborrheic dermatitis. So this is the common nagawa sa board exam, which is resorcinol is used as keratolytic agent. So we have hexyl resorcinol. So it is applied to the tongue that produces a sensation of numbness. So the phenol coefficient against Staphylococcus aureus is 98. So it is formulated into throat lozenges because of its local anesthetics and antiseptics properties. So if you observe in mga packaging and mga lozenges, there will be hexyl resorcinol as the ingredient. So let's go to oxidizing agents. So we have carbamide peroxide, topical solution. The other term is glyoxide. So it is a stable complex of urea and hydrogen peroxide. So we have there the molecular formula. So it is used as both antiseptic and disinfectant. So the preparation is especially effective in the treatment of oral ulcerations and dental care. So the oxygen bubbles that are liberated remove debris. So we have hydrous benzoyl peroxide. So it is, the other term is vanoxide or Oxy 5 or Oxy 10. So it is a white granular powder. So it is explosive when in pure powder form. The compound is formulated with 30% water to make it safer to handle. So compounded at 5% and 10%. So it is both keratolytic and keratogenic. Okay, so what do we mean by keratolytic? So denaturing effect on the keratin that produces excessive skin. So, okay. So it can be used also for the treatment of acne. Okay, so as may dagayap the common form that or the common dosage form that is used for treating acne is ointment. So one pinaka-common treatment is which has a active ingredient of benzoyl peroxide. Okay, so for halogen-containing compounds, so we have iodophores. So complexes form that retain the germicidal properties of the iodine while reducing its volatility and remove its irritant properties. So iodine, take note of this. It is one of the most effective and useful germicides. Okay, so again, iodine is one of the most effective and useful germicides. They are both bactericidal and fungicidal. So we have here the different official preparations of iodophores. So we have iodine tincture. with a combination of 2% of iodine in 50% alcohol with sodium iodide. We have also have strong iodine solution. The other term is Lugol solution, which has the preparation of 5% iodine in water with potassium iodide. And then we also have iodine solution, 2% iodine in water with sodium iodide. So we have povidone iodine. Povidone iodine, which is the common brand, is the betadine. Isodyne, polymer, polyvinyl pyrrolidone, or the PVP iodine. So it is a charge transfer complex of iodine with the non-ionic surfactant. So the complex is extremely water soluble and releases iodine very slowly. So 10% of the iodine is bioavailable. So it is used as an aqueous solution for pre-surgical disinfection of the incision site. So the iodine available dosage forms can be aerosols, foams, ointments, surgical scrub, antiseptic gauze pads, sponges, mouthwashes, and a preparation that disinfects bath and hot tubs. So as you can see in the market, we have the different dosage form of povidone iodine. Can be vaginal wash, for wounds, gargle, and mouthwashes. Okay. So we have also chlorine-containing compounds. So chlorine-containing compounds, so this has been used as disinfection of water supplies. So the discovery that hypochlorous acid is the active germicidal species that is formed when chlorine is dissolved in water. Okay. That led to the development and use of the first inorganic hypochlorite salts such as sodium hypochlorite and calcium hypochlorite. Again, the hypochlorite salts produced are the sodium hypochlorite and then calcium hypochlorite. So we have here the organic and chloro compounds were developed as disinfectants. So these compounds release hypochlorous acid when dissolved in water, especially in the presence of acid. So it is slowly released hypochlorous acid in water. So the antiseptic effect of this agent is optimal at around pH 7. So we have chlorine-containing compounds. So two equally plausible mechanisms have been proposed for the germicide. So we have first the chlorination of the amide nitrogen atoms. Next is the oxidation of the sulfhydryl groups in proteins. So we have first the halazone. So the other term is para-dichlorosulfonamol benzoic acid. So it is used to disinfect drinking water. Okay? So, siya din yan ginagamit ha, mga mineral waters. Okay? So, halazone. So, we have chloroazodine. The other term is NN-dichloro-dicarbonamidine or azochloramide. So, it is a bright yellow crystalline solid with a faint odor of chlorine. So this glyceryl triacetate solution is used as wound dressing. Okay. So we have oxychlorosin sodium or the chlorpactine. So it is a complex of the sodium salt of dodecylbenzene sulfonic acid and hypochlorous acid. So it occurs as an amorphous white powder that has a faint odor of chlorine. So the agent has a marked and rapid cidal action against most microorganisms, including both gram-positive and gram-negative bacteria, molds, yeast, viruses, and spores. So typical application uses are 0.1% to 0.5% concentrations in water. And dilutions of 0.1 to 0.2% are used in urology and ophthalmology. Okay, so let's move on to the cationic surfactants. So what is the use of the cationic surfactants? So these compounds are quaternary ammonium compounds. So the surface activity of these compounds exemplified by lauryl triethyl ammonium results from two structural. So we have the cationic head group, which is high affinity water or hydrophilic, whereas the long hydrocarbon tail, which has high affinity for lipids, or the lipophilic and non-polar solvents. So the cationic surfactants exert a bactericidal action against a broad spectrum of gram-positive and gram-negative bacteria. So they are also active against several pathogenic species, fungi, and protozoa. So we have benzalkonium chloride. So it is also known as alkyl benzyl dimethylammonium chloride or the Zephyran. So it is a mixture of, it is used as detergent and emulsifier and a wetting agent. So it is used as antiseptic for skin and mucous membrane. And then it is also used for irrigation, for storage, and for storage of surgical instrument. And benzyl chloride is added with 0.5% sodium nitrate that is used as preservatives. So they have low systemic toxicity and absorption to the tissue causes lysis. So we have the methyl benzethonium chloride, so or the diaparin. So adenine diaparin. So it is used for the treatment of diaper rash for infants uh, that is caused by the yeast Candida albicans, which produces ammonia. So the agent is also used as a general antiseptic. So its properties are virtually identical to those of benzethonium chloride. So benzethonium chloride, the other term is femerochloride. So the action and uses similar action with benzalkonium chloride. So it is used with skin antisepsis, irrigation of mucous membrane, and it is also available in tincture. So we have pyridinium chloride. So it is used as general antiseptic for intact skin, for minor laceration, and for the irrigation of mucous membranes. So it is also available in the form of throat lozenges and mouth washes. Okay, so cetylpyridinium chloride is generally used for gingivitis. Okay, so we have chlorhexidine gluconate. So we have Hibiclins. The new generic name is the Hisohex. So it is the most effective of a series of antibacterial big 1H which originally developed in Great Britain. So it is treatment for burn and acne vulgaris. Okay, so it is used in neonates prophylaxis of streptococcus and staphylococcus. And then 4% concentration of these agents and better act than hexachlorophene and iodine. So this has been used for topical use and preoperative skin disinfection, but this is not advised to leave the residue in the skin after administrations. Okay, so let's proceed to the dyes. Okay, so the dyes were used very extensively as an anti-infective agent before the discovery of the sulfonamides and then the antibiotics. So cationic dyes are active against gram-positive bacteria and many fungi, whereas gram-negative bacteria are resistant. So the dyes form colorless leucobase. So the term leucobase here is a colorless or weakly colored amine that is formed by reduction of the dye. Okay, so the difference in susceptibility is probably related to the cellular characteristics that underlie the gram staining. So we have the gentian violet. So it is commonly used for vaginal suppositories for the treatment of yeast infections. Okay. So basic fuchsin. So it is a mixture of the chlorides of rosanilin and para-rosanilin. So it's component of carbol-fuchsin solution, which is the Castellani's pink. So it is used topically in the treatment of fungal infections and for athlete foots and ringworm. So we also have the methylene blue. Okay, so the methylene blue here, so it is the antidote for cyanide poisoning. Okay, again, the antidote for cyanide poisoning is methylene blue. Okay, so methylene blue also is the primary emergency treatment for symptomatic methemoglobinemia. Okay, again, methylene blue is used for the antidote for cyanide poisoning, and it is also used as the primary emergency treatment for symptomatic methemoglobinemia. Okay, so the compound colors in urine and stool is blue-green. Okay, so if you ingest methylene blue, your urine and stool could be blue-green. Okay. So we have mercury compounds or mercurials. So elemental mercury, it is incorporated into ointment bases that was used topically for the treatment of localized infections and syphilis. So we have the different inorganic salts of mercury. We have mercury chloride and mercurous chloride, which is used as antiseptics. And ammoniated mercury, so it is used for impetigo, psoriasis, and ringworms. While the mercuric oxide, which is used to treat inflammation resulting from infection of the eye, but it is barely used because it can cause a hypersensitivity reaction to the tissues. So we have organomercurial. So they are grouped into two general classes. First is the compounds with at least one carbon mercury bond. Second is the compound with mercury bonded two heteroatoms. Okay, so the mode of action of organomercurials, the antibacterial action of mercury compounds is believed to result from their reaction with sulfhydryl groups and enzymes and other proteins to form covalent compounds. So the organomercurials, the antidote is cysteine and dimercaprol. Okay, so if you ingest too much organomercurials, the antidote is cysteine and dimercaprol or MAL. Next is nitromersol, which is the metofen. So it occurs as a yellow powder that is practically insoluble in water and is sparingly soluble in alcohol and most organic solvents. So it was very popular antiseptic for skin and ocular infections. So it is non-irritating to mucous membranes and non-staining. So we also have thimerosal, which is also known as the mertiolate. So it is a weakly bacteriostatic antiseptic that is applied topically in ointments and aqueous solutions. So we have preservatives. So these are added to various dosage forms and cosmetic preparation to prevent microbial contamination. So in parenteral and ophthalmic preparations, preservatives are used to maintain sterility in the event of accidental contamination during use. Okay, so we have first the para-hydroxybenzoic acid derivative. So these are the parabens. So which has the antifungal properties. Okay, so this property makes the parabens useful as preservatives for liquid dosage forms such as, so we have two, the methyl esters and then the propyl esters. The methyl esters is most effective against molds, whereas propyl ester are most effective against yeast. Okay, so we have methyl parahydroxybenzoate or the methyl ben. So it is used for molds growth. Okay, so we have the propyl paraben. So it is used as preservatives primarily to retard yeast growth, which has a pH of 10. Okay, so for butyl paraben, so N-butyl parahydroxybenzoate occurs in white crystalline powder that is sparingly soluble in water but very soluble in alcohol and in non-polar organic solvents. So we have ethyl paraben. So it is a white crystalline powder that is slightly soluble in water but soluble in alcohol and most organic solvents. So other preservatives, we have chlorobutanol. So it is most commonly used as bacteriostatic agent in pharmaceutical for injections, ophthalmics used, and intranasal administration. So we also have benzyl alcohol, which is also known as phenylcarbinol and phenylmethanol. So it is used as preservatives in vials for injection, combination with 1 to 4% of water or saline solution. So the main use of benzyl alcohol is as local anesthetic action. So it is used as in ointments and lotions as antiseptic for the treatment of pruritic skin conditions. So we have phenylethyl alcohol or the benzene methanol, orange oil, and rose oil. So it occurs naturally in rose oil and pine needle oil. So it is used primarily in perfumery. So it has a rose-like odor and sharp burning taste. Okay, so we have the benzoic acid. So it occurs naturally in gum, benzoin, and in Peru and Tulu balsam. So it is more effective as a preservative in foods and pharmaceutical products. So we have oral. So it is used as sedatives and hypnotics, used to allow vomiting due to gastritis. And the other dosage form is topical, which is used for dental analgesic, local anesthetics, and yun. So we have sodium benzoate. It is used as preservative in acidic liquid preparation in which benzoic acid is released. We also have sodium propionate, which is effective as antifungal agent, and sorbic acid. Uh, it is used as antifungal also and used to inhibit molds and yeast. So we have potassium sorbate. Okay, so it is also used as or can inhibit the growth of molds and yeast. So it has low toxicity, but it can cause irritation with when exposed to skin. We have phenyl mercuric nitrate. So it is a mixture of phenyl mercuric nitrate and phenyl mercuric hydroxide. So it is used to preserve injectable drugs against bacterial contaminations. We also have phenyl mercuric acetate. So we have acetoxyphenyl mercury occurs as a white prisms that are soluble in alcohol but only slightly soluble in water, and it is also used as preservatives. The disadvantage of phenyl mercuric nitrate is that organomercurial uh, it reduced the antifungal effectiveness when uh, added to syrup. Okay, so antifungal agent will be discussed next week. Okay, so we are now done with the first part of anti-infectives. Any questions? Are you already bombarded?
Yes, ma'am.
Yes. Okay, so let's have the attendance